In 2014, almost 200,000 people fled from war-torn South Sudan to West Ethiopia and finished their journeys in the Gambela region. Starved of food and clean water, the refugees arrive in very poor health.
The majority of the arrivals are mainly women and children. I think it accounts for about 90% of the number. These people, due to the long distances they have to walk, they arrive basically in a fatigue state and very tired.
Nujunros left South Sudan with her 3 children after her husband died. It took them 2 weeks to walk to Gambela.
We survived on the fruit we picked off trees and grass that we cooked. We were very hungry and thirsty. My son has already been ill, and I brought him to the hospital, but now he's sick again because of our shelter, our living conditions.
Okay. No vomiting, no diarrhea? This child was admitted yesterday. He's about 4 months old. He presented with cough and fever. We started the treatment for lower respiratory tract infection, and he needs oxygen. He's breastfeeding, but so it's going slowly. It's only since yesterday. We will see how it goes.
Exhaustion, malnutrition and poor sanitation all contribute to the spread of infectious diseases in the region's camps. And that's not counting the torrential rain that regularly floods the camps and worsens still further the refugees' living conditions. MSF is working in 3 camps near the border, notably in Lechor camp, where teams have set up a 100-bed hospital with an emergency room and malnutrition treatment. 20 to 40 pregnant women go to the maternity unit every week.
A lot of them have faced a lot of trauma. A lot of them have seen their family members die in front of them. Once they're here, the conditions are very hard. It's insecure for women. Sometimes their husbands aren't here. So to live here when they're in a life of insecurity is very, very hard.
So you finished 2 boxes, huh? I give you 2 more.
During the summer of 2014, MSF carried out a cholera vaccination campaign to prevent a possible outbreak of the disease. Some of the refugees may have been carriers of the cholera bacteria, as there had been an epidemic back in South Sudan for several months. 155,000 people over the age of 1 year in the camps and surrounding villages have been vaccinated.
If there happen to be any case of cholera, it's going to be an explosion, which is going to be very, very difficult to manage because the site is waterlogged. To maintain hygiene, it is not so easy for anyone at all.
Such poor living conditions, aggravated by the rainy season, increase the risk of respiratory infections. So in November, MSF launched another multiple vaccination campaign to prevent pneumonia and reduce infant mortality. Around 76,000 vaccine doses were administered to South Sudanese children.
South Sudan is the world's youngest country, but on the eve of its 3rd birthday, conflict is tearing it apart. Over 1.5 million people have fled their homes since fighting erupted in 2013. And as entire towns and villages have come under attack, medical care has also come into the firing line. In Malakal Teaching Hospital in Upper Nile State, MSF was responding to an outbreak of a deadly disease called Kala-Azar. It's spread by the sandfly and is fatal if left untreated. When the conflict started, MSF also provided emergency treatment to victims of violence. On February 22, 2014, MSF teams returned to the hospital after heavy fighting had forced them to temporarily withdraw. They found 14 dead bodies in the hospital compound, but this wasn't the result of Kala-Azar. It was the result of a brutal attack on the hospital. In amongst the patients too weak to flee for safety, 11 patients had been shot dead whilst lying in their beds.
You know, they used to come, 10 or 5 or 15, they come in there with gun, You tell if you don't know your mobile, your money, your what, if you don't give, they just shoot you. All of us, in all words, that are in that hospital. And some of them are shot. And even they took some girls and some women. They took it, and where they are now, we don't know.
Lo más espeluznante era ver que había pacientes en sus camas que compartían habitación con algunos de los cadáveres durante varios días sin tener ningún tipo de asistencia médica. Todo estaba revuelto, tirado por los suelos, era irreconocible como un hospital.
MSF evacuated several of the most severely ill patients to a UN base for treatment. 13 were gunshot victims. MSF has a long history of working in Malakal. Despite temporary evacuations, MSF have continued to treat patients throughout the fighting. But after the February attacks, the hospital lies empty. MSF is working in a UN-protected base, but without the facilities it had before the conflict. The threat of violence is never far away, and MSF is desperately worried about the people who remain cut off from healthcare. The attack on Malakal Teaching Hospital was not an isolated incident. Only a few weeks earlier, an MSF hospital was completely destroyed.
No vomiting last night, but vomiting before she came in.
Leia Hospital was one of MSF's longest-running projects. The hospital where MSF had worked for 25 years provided a critical lifeline for 270,000 people in the surrounding area.
So this is our inpatient department. We treat patients for various reasons. Brucellosis, pneumonia, Kala-Azar, but we get so many patients here that we can't just contain them to the ward inside like you would normally at home.
It was also the only hospital in the area where people could receive inpatient care. But following weeks of insecurity, at the end of January, 240 of MSF's South Sudanese staff were forced to evacuate Leia Hospital. They fled into the bush, taking dozens of severely injured patients with them as they went.
This was, I think, a very difficult time for all of us. We feel powerless in regard to such kind of situation. We feel powerless as well when it comes to this hospital that we've been running and building over the last 25 years. And it got completely burned and destroyed despite all our messages and contact with the different parties in the conflict.
Weeks later, as the fighting calmed, MSF teams returned to discover an horrific scene. Buildings had been reduced to ash, equipment had been smashed, and drugs and other supplies strewn throughout the hospital grounds. But the scenes in Leia and Malakal are only part of the picture. MSF has recorded a number of other incidents. People across South Sudan count on MSF and others for critical medical care. But medical care has come under fire in South Sudan. Rather than safe havens for treatment, medical facilities have at times become targets of attack. But when hospitals are destroyed and staff and patients are attacked, it's people in need of healthcare who suffer the most.
At any given moment, MSF teams are treating patients in a range of emergencies. Nearly a third of MSF's projects are in conflict zones. Here, people are caught in the crossfire and cut off from healthcare services, unable to get the assistance they urgently need. Our teams work to establish safe spaces for patients and for medical personnel. Team leaders actively negotiate access to communities where the needs are greatest. They do this by communicating with all sides to a conflict and explaining MSF's guiding principles of neutrality, impartiality, and independence, along with the healthcare services we offer. In many places, this allows MSF to work where other organizations can't. Even as fighting continues, our teams assist the wounded and others affected by war with a range of critical services, including surgery, emergency obstetrics, and maternity care. MSF also provides primary health care, vaccinations, mental health counseling, and more, adapting programs to people's health needs. When an earthquake, hurricane, or other natural disaster hits, experienced MSF staff evaluate the situation on the ground to identify the most urgent needs. At warehouses in logistical hubs around the world, teams assemble medicines and supplies and send them as quickly as possible. Staff in the disaster zone can then start treating the wounded and reinforcing battered medical systems. This might mean setting up an inflatable hospital for emergency surgeries, providing water and sanitation services, or running programs to prevent disease outbreaks where people are taking shelter. Conflicts, natural disasters, and other crises can drive people from their homes, forcing them to flee unstable circumstances in search of safety. Too often they find more uncertainty and hardship, along with poor living conditions where public services are scarce. Here, MSF responds to the particular health needs of displaced people by treating illnesses and injuries, preventing disease outbreaks, battling malnutrition, and ensuring access to maternal and pediatric care. In some cases, teams also provide water and sanitation services or distribute essential everyday items like soap, cooking oil, and shelter materials. Women and children are particularly vulnerable to sexual violence in overcrowded camps or wherever law and order have broken down. MSF provides medical and mental health care for survivors of sexual violence and does community outreach to let people know that free, confidential treatment is available and that survivors should come in for care as quickly as possible. The majority of our patients are women and children, and we offer specialized care to attend to their specific needs, particularly around maternal health and childbirth. In many MSF projects, we offer comprehensive care for mothers and babies. This includes prenatal, postnatal, and newborn care, along with emergency care for complications from deliveries, such as obstructed labor and postpartum hemorrhage. Malaria, cholera, and measles are just some of the diseases MSF tackles. Our epidemiologists track outbreaks, while other medical staff treat the sick and launch prevention efforts like vaccination campaigns. Community outreach teams let people know how to identify and halt the spread of a disease while we test for new cases. In 2014 and 15, MSF took the lead in responding to the massive Ebola outbreak that struck West Africa, treating more than 5,000 people and repeatedly calling on the international community to do more to help. Starting in the year 2000, MSF began treating people with HIV and AIDS. We now provide antiretroviral treatment to more than 341,000 people in 20 countries. MSF also runs a number of programs for those with tuberculosis and drug-resistant TB, as well as dangerous HIV-TB co-infections. For MSF, it's not enough to just provide medical services. We also speak out about what's happening to people. We advocate for our patients in meetings and in statements directed to governments and to the international community, as well as through the media and other platforms. The message is always the same. People at risk should be able to access health care, and medical workers, even in active conflict zones, must be allowed to provide it according to the Geneva Conventions and international humanitarian law. MSF also believes that life-saving medicines and vaccines must be affordable and accessible to the people who need them most.